USAA knows dynamic duos can save the day, like superheroes and sidekicks or auto and home insurance. With USAA, you can bundle your auto and home and save up to 10%. Learn more and get a quote at usaa.com/bundle. Restrictions apply.
Hey, it's Paris. You know I love sparkly things, right? Like stars. Duh. And thanks to Hilton and AutoCamp, I just slept under them. Picture me, serving looks by the fire outside my luxurious Airstream, making s'mores with the kids, while a national park is our backdrop. The great outdoors meets Hilton hospitality. That's hot. Explore all the new ways to stay at Hilton.com. Hilton for the stay.
The Dental Download podcast is your source for insight from conversations with fellow dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Dr. Haley. Let's get into this week's episode. All right, everyone, we have a guest here today. So would you be able to introduce yourself and tell us about your background in dentistry so far?
I am Dr. Kairavi Patel. I am a general cosmetic restorative dentist in Austin, Texas. I am 5 years out of school. So I'm not freshly out of school, but enough experience where I'm still early on in my career. So I would say it's still pretty new. But yeah, when I first started, I didn't do a residency. I started working right out of school. In the middle of COVID, so that was a lot of fun. Luckily, I already had a job lined up when I was in my 4th year of dental school, and they were just kind of waiting on my license. So that job I'm really grateful for. Many people probably don't say that about corporate jobs, but it was a huge learning experience. I worked for I'm not sure if I'm allowed to say like where I've worked. Am I?
Up to you. I mean, people do.
How about I don't?
That's
Just
okay.
in case I say anything negative.
Fair enough. I don't blame you. But so some corporate job, and then now where are you working?
So I went from that corporate job. I worked there for about 11 months. And then after that, I worked 2.5 years at another corporate. I did a startup with a corporate company. And then after that, now I'm working at a private office. It's pretty awesome. I work there full time. It's like such a great environment. I really appreciate where I'm at right now because I did work at other jobs that, weren't the best. I mean, but jobs when you first start out, they're not going to be perfect, especially when you're learning exactly what procedures you like to do and what type of working environment that you thrive in. So while they were not the most fun jobs, I learned the most. Like things like my first job, I was thrown into doing molar root canals like on my first day. Like on my first day ever working, I did a molar root canal. It was wild. And I never did any molar root canals in dental school. So you kind of just have to like figure it out, do the best you can. You learn a lot about patient communication and things like that, especially if you like don't have I didn't have any dentists with me. It was just me as the primary dentist in the office. I learned molar root canals. I got Invisalign certified at that job. Now that I'm 5 years in, I know that like being Invisalign certified does not mean that you are like and I'm sure you know this too, does not mean that you know everything about Invisalign just because you're certified. That is just like the sip of water compared to like the ocean amount of information that's out there. So it was a huge learning experience in the beginning. I would see these ClinChecks and I would be like, looks good, I think, and then like approve it. Now I'm sitting there and like readjusting all of my ClinChecks and looking at it from every possible angle that I could look at it before I approve anything. And now I know like a bunch of the tricks that you can do with Invisalign, like live updates and like grid lines and things like that. So that's that. I guess that's the synopsis on who I am right now.
That's awesome. And you're based in Austin, Texas currently, right?
Mm-hmm.
Have you been there since graduating? Did you go to dental school in Texas too?
I actually went to dental school in Florida at Nova Southeastern University. Amazing school. Very expensive school, but an amazing school, which is why I felt comfortable being able to go into practice immediately after graduating.
And at that point, were you finding it difficult to find jobs wherever you wanted to move? Or especially with the COVID, you said it was so weird. So did you graduate right kind of the spring that COVID first started?
Yep,
Okay.
exactly. I was lucky enough that I finished all my requirements in February. So I was kind of just coasting, just like hanging out. And they shut down clinic in March, I believe. Requirements weren't really an issue. It was more so about, at that time, we had to do patient boards in April. That was when it was planned for. And because COVID hit, we weren't able to do patient boards. So the school was trying to work with CDCA to try to figure out how we were going to be able to do our boards. And we were all kind of in limbo. Like we had our graduation over Zoom. It was pretty wild. It was anticlimactic for like long 4 years that you work so hard for, and I feel for every 2020 grad because you never really got to celebrate your hard work. You just kind of were thrown into turmoil and you just kept going. But yeah, we ended up taking. They figured out that we could do typodont boards in June. So I ended up flying. I lived in Houston with my parents after I graduated. So I flew back to Florida, took my boards, and then flew back home to Texas. And I still had my job. My job was still waiting. A turn of events, I actually I severed a few ligaments in a nerve in an accident. So I passed my boards in June, and then in July, I got in a huge accident. My job still was like, hey, we'll wait for you. So I was super appreciative of that job. I didn't have to worry about whether or not I was going to be able to pay off my student loans.
Yeah. So I know your first couple jobs were corporate, and you mentioned you were the like lead dentist, only dentist on site at the first job.
Hmm.
How did you go about seeking out mentorship and like expanding your skills beyond what you learned in dental school? I know it sounds like it was just doing a lot of the things that you weren't comfortable with till you got comfortable, but is there anything beyond
Yeah.
that helped you?
So I did a couple things. The first job that I was at, there was a lot of mentorship. So if you wanted to, they had like a lead dentist at like a different location that was working full time. And if you had any questions, any clinical questions, you could contact one or two of the dentists. And most of my molar root canals, or if I ever felt like I was like scared to do something, I would just call them, send them a picture or a PA, and they would kind of walk me through it. So I really appreciate that. They kind of like helped me they were like, you know what, it's fine. Just like, just go through it with confidence. Sometimes with molar root canals, you're scared to take a risk. Or you don't really know like if you should like search for a canal in like a certain area because you don't want to pulp out. So it was nice having like people that were kind of like pushing me to take on challenges. And then if at some point I was like, okay, now I'm bothering these people. Now I got to start figuring out things myself. I did get more confident with doing harder procedures. And then if there was anything like a patient would ask that I didn't know, I would just go on NCBI and just look up research articles. And I think patients appreciate that. Like when you use like facts before you give them an answer. If a patient was like, hey, I want to know about like hydroxyapatite versus fluoride, and if I didn't have an answer for them, I would tell them, you know what, let me look into that and I'll let you know. And they kind of appreciated that I was giving factual information. And it's also good for you, for your own personal knowledge, to know that what you're recommending is based off of facts. So that's the two things that I did. I reached out to my mentors with my jobs, and then I also did my own research.
And it seems like now that you're in private practice, you're kind of honing your procedure scope down to things that you really enjoy doing, which is
Hmm.
probably so nice. So, what was it like transitioning into private practice? How did you find that opportunity? And what does most of your procedure scope look like these days?
How did I find this job? So that I feel like a lot of people should do this. If you are in limbo and you're trying to look for a place that you fit in, I would temp, learn about like the different team dynamics that you like or don't like. Learn about if you want to be in an office that has multiple doctors, or if you're okay with it just being you, or if you like offices that do a lot of restorative or patient populations that have a little bit more money and can like invest in cosmetic treatment. So in that process, of temping, I was really being mindful of all of the things that I really wanted. And I ended up finding this job while I was temping. And the patient population was amazing. The team was great. I did make sure to ask at all the offices that I temped at, because they did all offer me jobs, how long the teams were there, because that I feel like contributes a lot to like the culture in the office. And the office that I'm at right now, the assistants have been there for like 5+ years. I have one hygienist that's been there for 10 years. I really like that. If your team can be there for years and years, that means that leadership is also good. And sometimes it's hard to see that right away. So he actually offered me the job, and he was like, you know what? Let's have you temp here and we'll see how it goes. So he also made sure that I was a fit for the team as well, which was I do appreciate. Like it goes both ways when you hire an associate. I ended up being a great fit for them, and it was a great fit for me. And I started working there. Can't remember your other question.
So now that you're there, I mean, you do general, all type of dentistry. You mentioned you're
Hmm.
involved in cosmetics as well. Like, how did you decide you wanted to kind of lean more into cosmetics, and how
Yeah.
often are you getting to do those cosmetic cases versus general restorative work?
Yeah. So how did I know that I wanted to get into cosmetic dentistry? I knew before I even started dental school that I wanted to do cosmetic dentistry. And then we had a course in dental school that was about cosmetic dentistry. Loved that class. So I knew that no matter where I went, I was going to do cosmetics. My first job, my corporate job, I was doing cosmetics there. My second job, I did a lot of veneers, a lot of anterior um, treatment, a lot of in between with Invisalign and veneers. Now that I'm like 5 years into practice, I know how important it is to have a healthy occlusion, and Invisalign is almost like a must if you're gonna have a patient do veneers, because 99% of the time, okay, not 99, I would say like 95% of the time, patients don't have the ideal bite for a veneer or multiple veneers. So doing like the combo ortho and cosmetic, I've been doing a lot lately. The patient population that I'm in right now, they're more so those types of patients, but they ask very good questions. They have really good dental IQ. So they ask really, really good questions about like cavities, how to read their x-rays, and if invasive treatments like crowns and veneers versus Invisalign is necessary, or things like, or if he could do whitening and Invisalign, or if they're a candidate for other treatments that are a little bit more conservative. I do like that it's it's a nice way to practice when patients also care about their dental care. So yeah, I also basically my first job I was implementing like basically procedures that I learned in dental school, which I learned a lot about cosmetics in dental school. I was able to do a lot of cosmetic treatment. So it was nice to have that foundation. My second job, I actually did a course on full mouth rehab and cosmetic treatments, and just like how to do it conservatively and kind of like the step-by-step process in order to do it effectively, like appointment wise, and how to teach your assistants how to do certain things, and how to make your temps look amazing and things like that. So I learned that in my second job. I took a course, and I've basically just been implementing everything that I've learned up until this point about cosmetics into my current practice.
What courses would you recommend for people that are interested in growing their skills in cosmetics?
Gosh, I can't remember. It was an online course. I'm going to look into it and I'm going to send it to you.
Thank
The
you.
course that I took, because it was amazing. It was so amazing. I got to look into it.
That's
But
totally fine.
I also did a Dr. Galler's, I think it's a Reignite course for Invisalign. And I think that course is great, especially if you want to implement Invisalign with your veneer treatment, because he gives you like a good foundation on how to look at Invisalign. It's not like, I wouldn't say it's like the end all be all and you'll learn every single thing, but it does get you comfortable with treating cases. And now Invisalign has the ability for you to plan veneer treatment with your Invisalign. I think it's called Smile. Is it Smile Architect? Something like that.
That's cool. I love
Do you
that.
utilize that?
We use a different clear aligner brand, so I haven't dabbled with Invisalign much since graduating. So I don't know
Really? What do
what
you
other.
use?
It's Sure Smile, so it's like the CEREC brand, like
Cool.
Sorona's brand. But I mean, generally, like the interface is pretty similar. But I don't
Yeah.
know about if it has the cosmetic crossover stuff or not. That's cool. So in dental school, it sounds like you really tried to make the most of your experience. I mean, you were done with your requirements early. Seems like you had a great experience at Nova. What advice would you have for current dental students?
What advice would I have for current dental students? Make the most of your clinic years. I wouldn't say most of my classmates, but a lot of people would go to school, do the bare minimum, and then like go home. I really didn't want to do a residency. I leave myself the option to do it, but I didn't want to. I was like, I'm gonna use my third and fourth years as like my residency, and I'm gonna hustle really, really hard. I was there probably 7 days a week, 6 days a week, and I would be in the wet lab till maybe 11:30 whenever they kicked me out. And if I wasn't working on my own cases, I was like helping people with theirs. So the more exposure you get to different treatments and like different mouths and all kinds of stuff, the better it is for you. Sometimes I would just like hang out with certain faculty and just like kind of see the things that they're seeing, or like just anytime they'll drop pearls, I was there. I was like, please. Like my clinic, not director, but actually she was a director. I had in clinic, we were separated into groups, and I'm not sure if this is how it was with you. And each group had two faculty members, and each faculty member had like their pros and cons. And I really, really wanted to be under this one faculty member because he was great with cosmetics. And I ended up getting on his team, thank goodness. And I learned a lot from him, but through him, he was like, hey, my student is really interested in this, or she's really good at this. And he would introduce me to other faculty members, and I would also learn from them. I think it was my fourth year, I had the ability to become honors prosthodontics, a candidate for that. And they only chose, I think, 2 or 3 people in my class to do that. So I was also able to see like a lot of harder cases. Like I was doing like implant bridges and things like that they would normally send over to the pros residency that we had at our school. Not all schools are like this, where like they have all the residencies. So a lot of your program has residency programs like pros and ortho and things like that, the harder cases go to them. So I did go to a school that had a bunch of residencies, so a lot of the harder cases went to them, and the stuff that like I guess was in between like a pros residency case and like a dental student case is like what I got. So it was cool like seeing all of that. If I were a dental student, I would just try to network, make friends, try not to be somebody that everybody hates. Be enjoyable to be around, be a good person, don't be a gunner. You're going to be stuck with these people for 4 years, and you see each other at your worst. You see each other when you haven't slept, and you see each other in like high stress situations. So be kind and don't be a gunner, don't be a liar. I feel like all of that, like true colors will show if you are any of those things. So if you're a good person, then good will come around. And I think that worked out for me in my favor, because I was able to just learn a lot from a lot of people, and I made friends with a lot of like upperclassmen who also taught me a lot.
Dr. Patel, our guest today,
found a great fit at a clinic that follows a patient-first approach and values up-to-the-minute clinical expertise. And you know what helps support that goal? A practice with ADEC dental chairs, delivery systems, LED lights, and stools. Take the renowned ADEC 500 dental chair, for example. With a well-thought-out design for scientific pressure mapping for the whole body support and synchronized virtual pivot that eliminates readjusting when the chair is reclined or returned. To precision hydraulic motion for smooth, quiet starts and stops, patients stay comfortable. From your angle, the ultra-thin backrest and slim profile headrest provide ample legroom for under the chair for healthy positioning and optimal access. But superior comfort, precise positioning, and optimal access is just the beginning. Check out the link in my show notes to discover the rest of the ADEC 500 story.
It seems like, as you said, you had a really great experience and you really maximized it. But no matter how hard you work in dental school, it's still a big adjustment to working in the real world, of course.
Yeah.
So when did you start to kind of feel like in your groove when it come to practicing independently after graduating dental school?
I mean, you're right. Like there is a huge, it's like you're coddled in dental school and then you go into the real world and it's like, good luck, your license is on the line. And I went through a period of like 6 or 7 months where I was just like terrified. I was terrified if I did anything wrong because I was scared to lose my license. And then you start to just like become more confident in yourself. You know, I'm sure you feel the same way. Like you start to become more confident in yourself, your abilities, what you're capable of. My first 6 months, I think I came home every day with a headache because it was just like so much information and I like didn't know how to balance like drinking water and like a crazy busy schedule, you know? And like also your first job, and if you don't know how to like set boundaries, especially when you're like working for this huge corporate company like I did, like you're just willing to say yes to everything. And that can also be scary. So you're not only being pushed into a world of like seeing patients, but you're also pushed into a world of like, am I a fit for this place? Should I be working here? Should I find another job? Is there anything better out there for me? And trust me, there's way better. If you're questioning it, there's better out there. But yeah, I would say in the first 6 months, I was in the growing phase. And then after that, I became more confident. I started to call my mentors less. I started figuring things out a little bit better on my own, trusting my intuition a little bit more. So yeah, I would say 6 months. What about you?
It feels so gradual in a way. I am just going to be at a year next month because I graduated last.
Okay.
So, I mean, like overall, I feel pretty confident, but I think it's the practice structure I work into. Like, I have other doctors there. So, I think
Yeah.
that makes a big difference, and they're very supportive. So, if I was alone, I think I would have been more intensely scared at the early couple months, but knowing like if I needed something, they're literally right there. That
You
kind
were in
of
the most
helps a lot.
ideal situation.
Absolutely.
Congratulations.
Thank you. So, you went through a lot of the struggles that people that are in their first couple years out of school think about. Are there
Mhm.
any other things that you remember looking back to those first couple years that were big struggles or adjustments for you as a newly graduated dentist?
A big struggle for me would probably be not knowing when to leave. I was in some really tricky situations and sometimes I came to work and like I never knew if they were going to take away my hygienist or take away my assistant when I had like a full schedule or take away a full column. So a lot of the uncertainty really wore on my mental health and I wish I knew sooner what my breaking point was so I didn't struggle as much. Like if you know that you're not in a good place cuz normally I'm the type of person when I start something I want to finish it. So if I start a contract, I want to finish the contract. And that's how I thought about my first job, which is why I made it so long. Yeah, I wish I knew like what are my boundaries
Hmm.
in order to like keep a healthy mental state.
Did you find that it was hard to find another job, or you were just like, is this next one even going to be better? Was that part of what was keeping you from leaving, or was it truly just, I feel like I am supposed to stick this out?
As soon as I was like, I can't do this anymore. Like I was already looking for jobs. And with the way that my contracts were set up, you had to tell them way ahead of time. So yeah, I was interviewing before I even put in my notice. So I never really had that like, oh, is there anything better out there feeling, because I kind of pushed myself to the limit before, like, once I make a decision, that decision is firm. So before I told my jobs that I was leaving, I had another one in place. And if you're at that place where you want to find something else, I would do that. I would, unless you're unsure about what you want, like if you're unsure about what you want, then temp. There's no harm in temping. And it's nice. It's nice being able to like use different chairs, use different like hand pieces, and like learn how other offices are working and what type of like scheduling is like the most efficient, and you kind of learn all of that when you're temping, and I really like that.
And now that you're in a practice that you love and you're
Mhm.
really feel like you're kind of thriving in the type of dentistry that you love to do every day, do you feel like dentistry as a career for people that maybe are that early in their stages, they're not even sure if dentistry is right for them? Do you feel like it provides you a good quality of life, work-life balance, time to be with your family and friends, ability to kind of avoid burnout, all those things people are like, there's kind of two ends of the spectrum of how people feel
Yeah.
about dentistry, but what's your insight on that?
Mm, Now that I'm in a healthy job, I would say that the work-life balance is pretty great. As soon as I mean, unless you're like me, like sometimes you'll be like opening up the fridge and you're like, I wonder how that patient is doing. Um, I mean, overall, I think it's a pretty good work-life balance. When you walk out the door, 95% of the time, the work doesn't follow you. And you check in when you walk in, you check out, especially as an associate. Um, as an owner, probably not. As an owner, it's like a 24-hour job. As an associate, you have the freedom to kind of just like have that separation. So yeah, I would say it's a really good, as long as you're in a healthy work environment, then there is a good work-life balance.
Hmm. I think exactly what you said. That's the key is what type of practice are you working in and is it right for you?
Yeah.
So I connected with you through your Instagram. I'd love to know a little bit more about your Instagram page and kind of how social media has impacted your life so far.
All right. So Instagram, my goodness. So I actually stumbled upon the Instagram healthcare dental world by accident. I was just posting my dental school life in like 2017, 2016, and like the things that I was doing. And it caught wind by a scrub company, and I ended up becoming an ambassador for them. So it all kind of happened accidentally. And now that I'm with them, I notice how much bigger the healthcare world on Instagram is bigger. I mean, is. So it all happened accidentally. Now I just like post things that I love. I have some things that are in the works. So I don't know if you see this 6 months from now, you'll see all the things that are happening. But if you are looking to get into Instagram as a dentist, I would just say start with posting things that you love and post consistently. If you were looking for like brand deals or things like that, then um, I think people are really smart these days and they know what, like, if people are being salesy with them. So just like post organically. If you really like a product, don't wait on them to send it to you, like post it yourself and tag them. And it's something that you really want. If you really want to work with a company, then reach out to them and they'll see all your posts. They'll see how many times you've interacted with them. And there's coaching for that. There's like coaching if you want to do any type of like branding for companies. But A lot of times they will reach out to you as long as you're posting organically and kind of just showing what you love. Like if you love doing root canals, post your root canals and do it with your whole might. Like talk about the things that you use, the materials that you're using, the brands, because I feel like there's an audience for everybody. And post consistently. Like in my case, I'll post my day-to-day life a lot in my stories and like a lot of the procedures that I'm doing. I'm trying to get better about all the cool things that I do and like documenting that for Instagram. A lot of patients actually follow me on Instagram and they love seeing the things that like I post. I think you can really tell the difference between like a dentist who really cares versus like somebody who's just in it for like the money. Because if you're in it for the money, you're gonna be sad. You're gonna be sadly mistaken.
This episode is brought to you by Indeed. When your computer breaks, you don't wait for it to magically start working again. You fix the problem. So why wait to hire the people your company desperately needs? Use Indeed's sponsored jobs to hire top talent fast. And even better, you only pay for results. There's no need to wait. Speed up your hiring with a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
The McDonald's snack wrap is back. You brought it back. Ranch snack wrap. Spicy snack wrap. You broke the internet. For a snack. Snack wrap is back. Ba-da-ba-ba-ba.
Yep, absolutely. So before we wrap up, do you have any final advice, any closing thoughts for people that are listening in today?
For new grads,
Yeah.
closing thoughts. I would just say work really hard. And I would say like in the beginning of your dentist journey, really hone in on the procedures that you love. You want to make going to work fun and you want to love all the things that you do. Like put your heart and soul into the things that you love within dentistry and you'll notice that like your life will significantly get better in your career. And if Instagram or social media is something that you also want to do, text me up or message me and I'll walk you through what I've done. Or if you need some help, please reach out. And I'll help anybody who asks me questions.
Thank you so much. I'll definitely be tagging you in all these and I'll put your Instagram in the description of the podcast and everything so people can get connected. Thank you so much for sharing some of your journey and your advice. I know it's going to help a lot of people.
Thank you so much. Thanks for allowing me to be here. This is so awesome. I feel so lucky and I'm excited. I'm excited to see if people actually like this.
They will. They will.